Okay, welcome everyone. Exciting times today. I'm Dick Burgess, Chair of the Huron Perth Healthcare Alliance, and it gives me great pleasure to welcome and introduce the Minister of Health and Long-Term Care, Deb Matthews. And I know you've been waiting and eagerly anticipating this, so it's all yours.
Well, thank you so much, Dick. It is wonderful to be here. I have come up this highway many a time, past the hospital, and it's great to be able to stop in and see firsthand the great work that's happening here. I have to say, before I visit a hospital, I do a little homework. I check out to see, we have some metrics we follow, and I wanted to share with you when I was researching what was going on here. One of the things we look at is ER wait times. So I always want to know what percentage of people are getting the care they need in the emergency department according to our targets. So when I look at Seaforth, I see 99% of people, we aim for 90%, 99% of people are getting in and out within 8 hours. These are high acuity people. And when I look at low acuity, it's 100%. So I tell you, there are a lot of hospitals in this province that would kill to have those numbers. So congratulations on that and many others. So I'm not here to congratulate you on your ER wait times, but I am here with some, I think, enormously exciting news. And I'm delighted to be joined by Michael Barrett, the CEO of the Southwest LHIN, and Ron Bolton, who's the Vice Chair of the Southwest LHIN, because they have been real partners in making today possible. So last year, when we brought in our budget, we included $20 million for small and rural hospitals to transform how they deliver services, because we all know healthcare is changing. And it's really important that people in smaller communities get the health care they need, but we know we have to kind of change how we deliver care. So we earmarked $20 million and said, this money we're going to allocate to the LHINs. The LHINs are going to talk to their smaller hospitals and make decisions about where this money can be allocated that really will spark transformation in healthcare. So that was a year ago. And it's taken us a year to actually make those determinations about where those healthcare dollars should go. I should just mention that $20 million ended up in our budget because of an agreement we made with the NDP. We needed their help passing the budget. It was their idea. And I want to give them full credit for saying, this is an investment we think should be made in small rural hospitals. And we said, yeah, we actually think that's something we'd like to do too. So it went in the budget and demonstrates to me what can happen if we put aside our partisanship and work together for the benefit of patients. So you can keep that in mind as we talk about where that $20 million has gone. We've, as I say, we allocated over $5 million to the Southwest LHIN. The Southwest LHIN took in proposals from their partner hospitals, and then had to make tough decisions about which of those organizations would receive money for what. I can tell you that when I look at the list of the hospitals and the projects that receive funding through this transformation fund, I am blown away by the creativity, the innovation, the focus on improving patient care that is demonstrated by these ideas. So there were a lot of great ideas, some of which could be funded, others of which could not. But I'm here today to announce the projects that are funded through this special dedicated fund. And I just had a demonstration of one of the projects that was funded. So imagine this. Imagine someone who is fighting an addiction, who is in a withdrawal management. People need regular contact with their healthcare professionals, but sometimes these people live quite far away, and it really is a burden to get access to the care they need. And sometimes that burden of distance is a deterrent to them getting the care they need, so they just don't access the care that they need. So we now have the world's first program where clients working through their withdrawal issues can be hooked up with a monitor in their own home, and they can access their health professionals using the miracle of the internet. So rather than having to have an appointment far away in another community, they can stay at home, have scheduled appointments where they can connect with the people they need to connect with, and then get on with their day. We're seeing stunning results. Patient satisfaction is very high. We're seeing better outcomes for the clients. They're sticking to the plan more. They're saving money on mileage and using that money, repurposing the mileage money to connect up the machines. It's a perfect example of better care for patients and better value for healthcare dollars. So because of the investment that we're making today, we'll be able to go from 2 cameras to 6 cameras. Now over the course of the year, that means maybe 24 patients will be able to access that care through this remote telemedicine. They call it TLC, telehome care, TLC. As I say, the world's first, and it started right here. So that's just one example. We've got other great examples of projects that are being funded through this fund. One of them will help with scheduling. We know that in rural Ontario, sometimes patients have to go to different places to get access to the care they need. So we'll have harmonized scheduling. That's a dream come true for a patient, to have that ability. So that's a project that will be funded. We'll have better electronic health records across the Huron Perth Healthcare Alliance, so that as people move from one setting to another, they're going to be able to, their records will travel with them. So we've got lots of really innovative projects that Michael and Ron and the team at the Southwest Lynn have deemed worthy of this new investment. It's very exciting. So I'm very pleased that right across this province we're announcing these projects. As I say, it's one-time funding, but it's transformational funding. We are going to learn so much from these investments. And another part of the deal with these investments is that everybody has to share what they learn from it. Because we think it's really important, if this project works well here, that health organizations in other parts of the province also have access to that information, so they too can make the investment. We might very well find out that you don't need an additional investment, you need to shift some spending around to improve access, to improve outcomes, and get better value. So we've got a range of projects. We've got some real innovation happening, and I just want to underline, these projects were the brainchild of the brilliant and thoughtful and dedicated people who work in our healthcare system in our small and rural hospitals. It's only because we've got innovative, thoughtful people that we're able to actually move forward on these initiatives. So here at Seaforth, there are 3 projects. So we've got $85,000 for the remote care and monitoring project for patients with substance abuse. We've got at Seaforth Community Hospital and Clinton General Hospital are leading the project to enhance the use of electronic health records in the Huron Perth Healthcare Alliance. That was $1 million was earmarked for that project, and we've got a major component of that is the Electronic Medication Safety Project. We know in our healthcare system that medication management is vital. In fact, I think the leading cause of people coming back to hospital within 30 days of being discharged from hospital is medication error. So we have to really focus on medication. We're going to be able to do that. And so the scheduling system is between Seaforth, Clinton, and Alexander Marine General Hospital in Godrich. So this will provide better scheduling for the patients here, and it will ultimately allow primary care offices to schedule their patients directly into the appropriate hospital clinic. That is fantastic news for patients. It's also fantastic news for those poor people in the primary care offices who have to sit on the phone for hours at a time trying to schedule appointments. So across the province, various innovative projects are being funded. As I say, an important part of this is that we're all going to learn from one another as we go through this. We're asking the LHINs to share those best practices. I'm enormously excited about this investment. It, as I say, was born out of the need to get a budget passed and the need to work cooperatively with the NDP to get that budget passed. But the value we're getting for that investment is enormous. And I'm just really delighted to be here in Seaforth to be able to share with you some of the good news that will be happening right here. And I'm sure another speaker is going to talk about some of the other innovations that's going to happen within the Southwest LHIN. So thank you very much. It's a real honor and a joy to be here. Thank you.
Thank you, Minister Matthews. I'm now going to call on Ron Bolton, the Vice Chair of the Southwest Local Health Integration Network. Ron?
Thanks, Dick. Welcome, everybody. Thanks for coming to Seaforth. I have a bit of history with this hospital, having been on the board at HPHA at one time. We used to have board meetings in this room, if you can imagine, and I swear there was as many people at a board meeting as there is out here right now. It always seemed to be very small. Thanks for coming. Thanks for Dick and Andrew and your team for hosting us today. Thank you, Minister Matthews, for coming here to make this announcement. You and I have been together before several times at events over the years, most of the time at small hospitals. You being here today is testimonial to your continuing personal support for these communities and these facilities. It is also very valuable recognition and acknowledgement by the provincial government of how important small, rural, and northern hospitals are to their individual communities. I'd also like to thank you for your vision and leadership in getting the Transformation Fund into the last budget. I was aware that you had to be nice to many people, but we're glad that you did. We all recognize that it is sometimes very difficult for small sites to have access to funds that can help with transformational changes. Now, on behalf of the board, I would like to thank the health service providers, the HPHA, and others for the hard work they put into the proposals that have been approved. As Minister Matthews mentioned, we were not able to approve them all, but we think we picked the best, but they're all good. That was the problem. If somebody has more money for us, we'll approve some more. I'd also like to commend Michael Barrett, Southwest LHIN CEO, and the staff at the LHIN for their dedication as they work through the process of compiling the recommendations for the board. When the Southwest LHIN board looked at the proposed initiatives, we wanted to make sure we stayed true to the objectives of the fund, such as improved collaboration amongst small hospitals for community care, family health care, and mental health and addiction services. We also deemed it important that the proposals consider whether the project could be finished within the next fiscal year, that it did not create new costs, and in fact, hopefully would lead to reduced costs, and would result in improved hospital performance. As well, the project had to contribute to improvements in patient quality and safety and good value for dollars invested. And lastly, the board had to consider whether the project aligned with the strategies in our recently announced publicized integrated health service plan. These strategies are: 1, improved access to family health care; 2, increase the value of the health care system for those we serve; 3, to improve the coordination and transition for those most dependent on health care services; and 4, drive safety through evidence-based practices. Alignment with these strategic directions was important as we considered the various projects. The LHIN will be working with all participating hospitals and agencies to monitor the implementation and to ensure these are all completed successfully. As suggested in Minister Matthews' comments, and our role in providing leadership to the entire healthcare system, not only in our area, but throughout the province, we are committed to sharing best practices and learnings. By doing so, there will be opportunities to build on what we achieve and make a real difference for small, rural, and northern hospitals throughout Ontario. We are pleased with the prospects that the health service providers put forward, and thanks again, Minister, and the province for making this possible. We look forward to the difference they will make in healthcare in these rural communities. Thank you.
Thank you, Juan. All the LHINs, and in our case in particular, the Southwest LHIN, has an awesome responsibility to work with limited funds and to get the best bang for the buck with the taxpayers' dollars. We at HPHA and Seaforth Hospital appreciate and take it as a tremendous vote of confidence that the Ministry and the Southwest LHIN has chosen our community, our hospital, at which to make this announcement, and backed up the symbolism with dollars by ensuring that HPHA, Seaforth, Clinton, etc. get funding that we will put to very good use. You've said some good things about what's going on right here, and now I'm going to call on Penny Cardno, who's responsible for a good portion of those great things that are going on here. Penny.
Hi. Huron Perth Healthcare Alliance Mental Health Services provides services in the hospital, we provide services in office-based settings, and we provide services in the community. Over 8,200 community visits are completed on an annual basis by our clinicians. Travel costs associated with this number of visits prior to the utilization of our telehome care project was in excess of $72,000 a year. The telehome care, or the TLC project, focuses on increasing the clinical team's accessibility to those individuals most in need of intensive outpatient mental health services. While there's little documented evidence or research in the use of in-home video conference technology in the care of individuals with mental health concerns, in May 2010, a pilot project was funded by the Southwest LHIN that permitted us to develop and evaluate the effectiveness of what appears, and is, as we know, the first ever home-based video conferencing mental health treatment. HPHA, IT staff, and mental health staff have worked together to develop a homegrown, secure video conferencing technology system that's used in the care of our patients. The Transformation Fund for Small, Rural, and Northern Hospitals supports this project and actually has been a dream of ours for the last 10 years. This was a project that physicians, psychiatrists, community mental health, addiction, consumer groups, we've talked about in Huron and Perth for over 10 years. As we consider the importance of access to care in rural communities, and as we've witnessed the increased success of Ontario telemedicine technology in linking patients to clinicians, the idea of bringing technology even closer to home was what prompted this plan. As a result of this project, we've seen an increase of 25% in our patients' wellness. We've completed an additional 930 patient contacts. And as a result of the savings in travel of $30,000, we've actually reinvested to purchase additional cameras so that we can service more people. On behalf of HPHA Mental Health Services, I wish to acknowledge the support that we've received from the Seaforth Hospital Trust. With the support of the Trust, we've been able to install the TLC technology from our offices here in Seaforth and have to date supported the mental health needs of 12 different individuals, and they've actually lived in Huron, Perth, Bruce, and Wellington counties. HPHA Mental Health Services now looks forward to working closer with Choices for Change and implementing the TLC program to support individuals with substance abuse challenges. Thank you.
Thank you, Penny. I'm overwhelmed by the attendance here of those of you, members of the community, staff, local organizations, municipal representatives who've come here to celebrate this tremendous day. And I'm unable to say everything that I would like to say, and that is why I'm calling on Andrew Williams, our CEO, to say what I've neglected to say.
He always leaves great opening lines. Anyway, it's my pleasure to thank everybody for being here this afternoon. If you've walked around our hospital at all or the Alliance, you'll see we have some visuals that kind of reinforce three things. They reinforce partnerships, they reinforce performance, and they reinforce people. And if you look at the investments that are being made here within the Alliance and at our partner small rural hospitals across the Southwest, they really are focusing on those three areas. If you don't perform well, and the Minister talked about the value for money, you're not doing your local community a service and you're doing the province a disservice. So focusing on ways you can improve your performance is key. If you're not focusing on partnerships, you're doing the system a disservice. Healthcare today is all about partnerships. And small hospitals have a great role to play within the continuum. And again, investments like we're making today can strengthen that. So we can work closely with Catherine and Choices for Change as an example to strengthen our ability to support people at home. And lastly, it's about people. If you can't support the people that work in the system, and most importantly, the people that you look after, you're not doing your job in the healthcare system. So when I look at the investments today, and we had a great tour over at the Trust building and the clinic, and one of the examples that we talked about was an individual who accesses the services remotely, who is able to go to school in another community, but is only able to pursue that education because they have access to the services locally and don't have to come back and forth and travel. So it's a great example of a small improvement at the individual level that makes our whole healthcare system that much better. So to the government, for your leadership, and I always say this whenever I have an opportunity with Minister Matthews, the most challenging portfolio in any government is the health portfolio. It touches everybody in one way or another. It tends to be political periodically. It takes strong leadership. It takes strong vision. And successful healthcare is a combination of looking after the people that we have and that we see today, and also being innovative and creative and planning for the future. And if you can balance those two things, you're golden. But you need leadership and innovation, and Minister Matthews provides that. So thank you very much for that. To Penny and your team for the role that you're doing. And it's kind of neat to hear that we're the first in the world to do something, right? I think that's really cool. But it's a testament to the passion and the commitment that we have. And there are examples, Goderich, in Grey Bruce, William Listowel, I see people from those organizations here today, that we can hang our hat on and say, darn, we're doing some great work. We're servicing our patients well. Our communities are lucky to have the organizations and the people here. So to Penny and your team, thank you very much. One thing I should say, and take advantage of being at the podium, Penny is going to be in Toronto on Saturday and is going to be receiving the Jane Chamberlain Award through the Ontario Psychiatric Association, which is given out annually to an individual in a community hospital, Schedule I hospital, who exhibits leadership and innovation in what they do. And it's so fantastic that Penny's getting that, and I think it's just a testament to her leadership and why we're so successful in the mental health area. So. And finally, I just want to acknowledge and thank the LIN for your leadership. It can be challenging when you're dealing with, I think, 150 plus partners in the delivery of healthcare services, which about 22 are hospitals. It can be challenging to keep everybody focused and everybody committed to the same direction. But if you look at what's going on in our lane, you look at the leadership that they're exhibiting, we don't have to worry about any other LHIN in the province. We've got the best one going here, and really are providing some good direction for us. And we do need that at the system level. While it's all about organizations and individuals, if you don't have good system coordination, you don't get maximum value. So I want to thank Michael and Ron and the LHIN team for all of that commitment that they bring to the table. So with that, Dick, I think you have a few parting words to sort of say what I've forgotten to say. We actually do this 5 or 6 times. We'll come back and forth. Thanks everybody for being here.